Dr. Doreen 𝗟𝗢𝗓 is the
Dr. Doreen is an expert in autism.
Doreen 𝗟𝗢𝗓.
Dr. 𝗟𝗢𝗓.
Dr. Doreen 𝗟𝗢𝗓.
Dr. Doreen 𝗟𝗢𝗓 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. I got to get to this question or Marina will stop speaking to me.
Okay.
My 3-year-old was diagnosed with ASD this year. He's currently getting therapy through a place, I'm not going to say the name, in Canada. We also had some dietary changes, but I'm wondering whether you have found other interventions approaches have been effective for your clients, even on an anecdotal basis. We want to make sure we're doing everything we can for our son to achieve the best possible outcome. But his expressive language skills are still quite low to develop. We're also based in Canada, where we find our options for services
Very
somewhat limited, and they want to know if you'll do a phone call or a personal appointment.
Yes, I'm happy to do a phone call and do an evaluation. It'll probably be a little bit later in the year.
And I think we expressed that not until after September.
Yeah, just life is insanely busy right now.
Yeah.
But there are many other things, and you don't want to necessarily try everything. You want to try the things that are appropriate for your child.
Yeah.
And so I do always want to start with Shannon and I have presented on this multiple times. There's a series of things that you kind of want to think about and these are like, first thing very important is sleep. Is your child sleeping? If your child's not sleeping, well, we need to deal with that and figure out, like get a doctor to look at it, figure out what you can do, figure out why the child's waking up and all that sort of stuff. Then you focus on biomedical issues, and the biomedical issues could be a variety of things, like you want to check stool and make sure it's normal, and is there anything going on with gastrointestinal? Does your child have bloating, other issues? And if they do, then we want to look at possible diets. Obviously, every child, I feel like, if you feel like they're ingesting a massive amount of milk, for instance, that's a pretty good indicator that they might need to come off casein.
Right.
If you're having a lot of bloating, that's a good indicator that they might need to come off gluten. There are diets that are helpful to the health and well-being of the child on a day-to-day basis, and when the child feels better, then they obviously learn better, right? And they're paying attention better and all that sort of stuff. And so those types of things are super important. Sensory issues we've been talking about a little bit today, and that's kind of important as well, is what are the things in the environment that are maybe so uncomfortable that the child is being isolating or something like that. So is the child in an environment where they are comfortable, I guess, is the word that I'm looking for. So you kind of look at all the external factors that you can control, and then it really becomes about other treatments, and the treatments are primarily ABA, speech, and specifically a certain type of speech therapy that I think helps our nonverbal kids get going, which is prompt-based speech therapy. Mm-hmm. And then, of course, there are some children whose energy levels are so dysregulated that you're looking at possibly occupational therapy type things. Now, that all said, there are some children where there's other issues going on medically or mentally, where medication can help the child stabilize to the point where they're actually able to learn more. For instance, if there's severe hyperactivity or attention deficit, medications for that are very helpful. If there's very severe obsessive compulsive types of behaviors, then any of the serotonin reuptake inhibitors can be helpful. So it's a matter of just like making sure that the child is medically, physically functioning at their best, so that you can actually then give them a ton of stuff to learn. And that kind of is how it all works.
Amazing.
It's hard.
Yes, it is, but we'll make sure that we connect you after September. Parker wants to know, he says, I hope that ACT gives grants for adults to get diagnosis, because he's heard that income is a huge barrier to getting the actual diagnosis, and he's volunteered his services if you need someone to verify claims.
That's so nice, Parker. I appreciate that. No, we do. We absolutely, diagnosis is one of the areas, and we don't care what the age is.
Yeah.
And we actually even have people that we can refer to as well for the diagnostic. But I'm happy to fund that through ACT.
There we go.
Absolutely.
And don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.